Hello and welcome to Health Talks, a doctor-led podcast series by HDFC Ergogen Insurance. What we do here is we call an expert and we try and answer to the queries that you have generally around any kind of specific disease, any kind of specific questions that you have around illnesses. Here we have a special edition, special episode where we'll be talking about anything and everything that you experience when you have any problems in breathing. And most of us have discomfort while breathing, either when we walk, when we are running, at times when we are doing our general activities and we feel breathless. A lot of people ignore it, a lot of people really get worried about it, but there are questions that we would want to know, and who better than an expert who's meeting these kind of patients on a daily basis. Here we have Dr. Gunjan Chanchalani, who's here from Vocard Hospital. She's director of critical care medicine. And who better than her can answer these questions, because she's been dealing with these kind of problems, these kind of people coming to her with these kind of problems on a daily basis. So welcome, Gunjan.
Thank you.
Thank you for accepting the invite of being here. First and foremost, before I go any forward, I just wanted to know your perspective on breathing issues, any issues related to breathlessness. What is it that you come across? And then we'll go to a series of questions that we have in mind.
Okay. Thank you so much, Somesh, for this invite and also for this introduction. I am actually a critical care specialist, and we often see the most serious forms of breathlessness. So when we talk of breathlessness, there are various reasons why a person would be breathless. It could be related to the lung. Most commonly, it is the lung. But nowadays, in young age group, we are also seeing a lot of heart problems, which may be adding to it, and there are kidney problems. But in this season, the winter seasons that we have, the mainly problems that we have are related to the lung, because the atmosphere becomes a little dry. There's a lot of fog. The pollution starts settling down because of the cold weather that is there. So it is at the earth's surface level, and this pollutants, when inhaled, causes a lot of issues. And in Mumbai, another issue that we are seeing more often, why people are coming to us as breathless, is because of exposure to these pigeon droppings, which we call as hypersensitivity pneumonitis. So breathlessness is something which we often tend to ignore, often till the age we are 40, 45, because we have a huge lung capacity. I often say this to most of my patients, and I would say it again here. God has given everything is in more than double. So till a huge amount of our lungs are destroyed, or we have this affected to at least 80-90% of our lungs, we don't develop these symptoms unless we are doing exercise to realize that, or we are stressing our limits. So since we have a sedentary lifestyle, we take lift for even 2 floors, we hardly walk, we have everything delivered to our house, we don't even go for a walk into our grocery stores as we earlier did, which would give us a capacity level that I could earlier walk 2 flights of stairs, today I can't walk. But when I'm not doing any exercise, I would never know. So because everything is in double, 2.5 times, the symptoms often are realized late and we get a late presentation. But breathlessness due to lungs is very, very common in the winter season. So when you talk breathlessness, it has to be evaluated as a whole. And breathlessness is a very subjective feeling. Nobody else can tell for you that you are breathless. It is a subjective feeling. Until you exercise, you won't know about it.
Right. So well explained. That brings me to some of the numbers and facts that I was reading before this podcast. Almost 626 million people live with breathlessness in India, out of which 52 million people live with severe breathlessness, is what this very relevant data says. Almost 33 million people are patients of asthma in our country, and 55 million patients with chronic obstructive pulmonary disease, which is more commonly also known as COPD. Now, this clearly indicates, and like you said, one could be the reason, the kind of lifestyle that all of us are leading. Most of us have stopped either exercising or doing the things, the normal course of things that we were doing, either going to the grocery store, just walking up and 2 floors and things like those. Also, somewhere pollution and the reasons because of which the AQI index has been seen the way it is, and especially in some of the cities and metro cities in our country, all of this put together is, I'm sure, contributing to these numbers. What is your view? What is your take on this?
So again, there are various reasons why we are getting. As I said, the asthma and COPD. When you specifically talk, when we talk of breathlessness, the reasons can be at multiple levels. It
Right.
can be at my upper airway. It can be at a lower airway, or it could be at the level of the alveoli, the balloons where the oxygen are taken up. Now, asthma and COPD are diseases where it affects the airways. That is the pipes from which the air go down into the alveoli, into the balloons. Now, when these air cannot go in and come out very smoothly, the coming out, it is leads to asthma and COPD. Asthma to a very great extent is reversible, and therefore would probably say the intermittent period between the episodes, people live a very normal life. They can do their exercises also if their peaks are controlled and if they are put on those inhalers and they are regular in their medicines.
Right.
But COPD is kind of largely irreversible thing, and it keeps on progressing with time, and it tends to affect more of smokers and more people who are living in a polluted area, because the smoke goes inside, it damages the mucosa. So inside our these pipes that we have certain things called as ciliary function. This ciliary function keeps the pollutants, or you could say the allergens, or all the dust that is there, the simplest, out of our airways. They are like, brushes which keep brushing it clean, but they need some amount of moistness or wetness. As the winter starts peaking in, the whole atmosphere around starts getting dry, and we are still used to living in an AC atmosphere. The CFC release, which makes it more dry, and this wetness reduces, so the brushing function reduces, and all these allergens, the dust, the pollutants keep accumulating inside our airways or inside our pipes, as I call, as you in the simple terms, and this will start aggravating the asthma and the COPD. So the mucus that becomes now thicker does not allow the air to come out smoothly, and it starts accumulating or growing inside, and it gives that sense of breathlessness. So asthma and COPD definitely have increased very rapidly as the pollution starts growing up, as we see in the winter seasons.
And one common word that we keep listening from a lot of people is sinus. And is it again related to all that we've been talking about? Is it something different? What is your view on that?
So sinus is something, because as we breathe the dry air, we have about 6 sinuses around who moisturize that air as we go inside. So the mucus vaporizer kind of a thing is there, built in our oral and a nasal cavity. So whenever we breathe, it will get moisturized, and then it will go to the lungs so that our cilia can work well. So these sinuses, again, as the atmosphere starts getting dry, the mucus in there also starts getting thickened, and they will stop the narrow openings of it.
स्पेशली हमारे देश में, हमारी कंट्री में, डॉक्टर, टीबी इज़ वन टॉपिक दैट पीपल वांट टू नो अबाउट. ट्यूबरक्लोसिस के बहुत केसेस होते हैं. आई थिंक द प्रॉब्लम इज़ कि इसको आइडेंटिफाई करना, इसको डायग्नोस करना बिकम्स अ बिट ऑफ अ प्रॉब्लम. एंड हर कोई इसके बारे में पहले सारे हम इलाज कर लेते हैं, उसके बाद देन समबडी थिंक्स अबाउट दैट, ओके दिस कुड बी अ ट्यूबरक्लोसिस एज वेल. What is your view on that, and especially tuberculosis of lungs, which will obviously be giving you symptoms of breathlessness and all of that?
So tuberculosis tends to affect a part of the lungs. So often people don't have breathlessness for a very long time. What they usually get is a small fever rise towards the end of the day, which again is put to, I was tired today, so I'm just feeling feverish. The other often thing that symptoms are there, a weight loss. I'm losing weight. Again, as we are using a sedentary lifestyle, we are happy about it. Oh no, I'm losing weight. And loss of appetite. So these are the 3 main symptoms which tuberculosis gives us. And hence the presentation is very late. There is some amount of dry cough, again, which we kept ignoring. But as the dry cough is there, we are actually spreading the tuberculosis to everybody around us. Especially now, since we are used to every office being in a closed thing with the AC, no air ventilation. So it keeps circulating. The good part is that it still does not happen in a very elite. It happens in the overcrowded area. It doesn't go to a very elite thing. There are newer drugs which have come up, so the cure is faster, better. Unless earlier there was the regimen which has to be taken for 9 months to 1 year minimum. Now we have the regimen which is like 6 months, 5 months, and patients get cured faster. To prevent tuberculosis, the main thing is having a very good diet. Not too fast. We often, again, we go for intermittent fasting, which is fair, but starting a day without eating is exposing yourself to tuberculosis.
One more thing that people don't talk about, and probably it's not been talked about so much, is lung cancer. When I was looking at data, almost 6% of cases in India account to lung cancer. And for our viewers, if you can share what are the early signs, what they probably will experience, and when should they consult somebody so that they can figure out what kind of signs they need to look at when it comes to lung cancer.
So lung cancer again is like a hidden enemy. It will not get manifested till it spreads, and
Right.
unfortunately, I think the worst kind of cancers would be lung cancer because it affects the. You can't stop breathing.
Right.
If I have cancer here, maybe I can just give a pain block here,
Right.
or maybe not move that hand. But lung cancer, you can't stop breathing. It's probably subjectively one of the worst feelings to have. The incidence again has increased, maybe because the diagnosis again is better, also because the pollution and the smoking is a lot, plus vaping, use of electrical cigarettes, which again are more harmful than regular cigarettes.
Right.
So these are all the reasons why it has increased a lot. The only symptom that we get in lung cancer is weight loss. Often the weight loss, breathlessness is pretty late, and one of the symptoms that we may get is blood in the sputum, small streaking, which may also be very occasional. It may not be very often. So once, we, in the morning, most of the time these coughs are more in the morning because you're accumulating the secretions in the night, and suddenly when you wake up in the morning, the cough is there, and when brushing you may see cough and a little streak. And we often tend to ignore, probably it is from the gums. So it does get ignored at time. So weight loss, fatigability are the two, I would say, the star symptoms that we should be aware of for any lung disease.
We have an interesting section, and just to make it more interesting, we call it kind of a fireside chat. We have a couple of questions which we keep listening, and what we did is we also went online and we saw what are the kind of queries that people search most of the time when it comes to anything to do with breathlessness, anything to do with lung infections and diseases. So allergy versus infection, what's the difference, is something that a lot of people look at, because whenever there is anything to do with breathlessness or lungs, people say it's allergy, let me take an Allegra, versus somebody then realizes after a while that it's infection. So what is your view on that?
So since you brought this point, I will add a little more to it. Allergy and as infection both will cause inflammation.
Right.
Just that the infection happens after some virus, bacteria entering our body.
Right.
Allergy is due to some pollutant or some dust particle which has entered our body. Eventually they lead to same kind of a cycle in the body which will cause an inflammation. Infection, because there is a enemy kind of who's entering inside, will kind of remain for a longer amount of time. But at least 70 to 80% of the infections that we get in competent people, young competent children as well as adults, are mainly viral. And these viral infections don't really require antibacterials. So taking azithromycin, going to a counter, this is what we should avoid. Because when we actually get an infection, this tablet won't work.
Right.
And that is the time when it will flare up to a big pneumonia, requiring admission, and maybe a worser prognosis. So it is, and we are kind of, when I'm having an infection, I take maybe it's viral, I take an antibiotic. Some of the bacteria inside which were, my immunity was taking care, are now getting resistant, and they will flare up the day my immunity goes down, and I will spread that around.
Right.
So the resistant bugs, if you must have heard in the newspapers also, India is the hub of resistant infections.
Right.
That is because the antibiotics which we are using. So definitely, whether it is allergen or infection, first 3 days, I would say, if it is allowing you are a competent person, healthy person, don't take antibiotics or anything, at least for 2 to 3 days. After 3 days, if you feel it's still persisting, visit a doctor before you start an antibiotic, rather than visiting a chemist and just popping a pill.
Just last but not the least, one myth that you come across most often when it comes to anything in and around lung diseases.
One myth. Probably I would just say that, I'm allergic, or maybe I'm allergic to this. Everything and anything that we
Is
say
allergy.
is I'm allergic. Okay.
So people
that
don't
is
want to accept it that they have
accepted.
asthma or bigger problem. They just want to say it's allergy
Yeah,
and
it's
it will be
allergy,
cured.
and not visiting the doctor for
Not
that.
visiting the doctor for that. So I will take your leave. We will see you in the next episode of this Health Talk, a doctor-led podcast series by HDFC Ergo General Insurance. Till then, stay informed, stay healthy, and stay insured.